Hi, I'm Al Mazak, State President of AARP Wisconsin, and I want to continue today bringing you facts about the healthcare reform debate that is taking place in our nation. As I said last week, all of the healthcare reform plans that are currently being debated in Congress would ensure that you and your doctor are the ones making decisions concerning your health. The majority of working Americans will continue to receive their health care coverage through their employers. In addition, health care reform will strengthen Medicare by eliminating billions of dollars in waste while lowering the cost of prescription drugs. Now for today's questions. Will health care reform lead to socialized medicine? Healthcare reform will not lead to socialized medicine. Will not lead to socialized medicine. Socialized medicine meaning the government directly owning hospitals, the government directly controlling and paying doctors and nurses. None of that will happen. The aim is to have a system that is very much like what our Congress has. People will choose from a range of quality, affordable private health plans, either offered by their employer or by a state or federally supervised insurance exchange, which possibly could include what is known as a publicly run option as well. Plans will have to accept everyone, regardless of health, regardless of age, and they will have strict limits on cost sharing so that coverage is affordable to all. Here are some of the other facts about the false issue of, quote, socialized medicine in healthcare reform. Fact: healthcare reform will preserve the employer-based healthcare system, which means that an estimated 200 million Americans will continue to get their coverage the way they are getting it now from their employers. Fact: for people buying coverage for themselves, there would be a range of private health plans to choose from. Also, the so-called public plan option would seek to give American consumers another choice if they can't afford or can't find an affordable quality private plan. The goal of the public plan is to give consumers the best value for their money and to force greater competition for their money among the insurance plans that are striving to get their business. Fact: every proposal that Congress is considering today would allow people to choose their own doctors and their own hospitals. So healthcare reform isn't about a government takeover of healthcare in our country. It is about guaranteeing for all Americans the choice of healthcare plans that are affordable, that offer quality care. It is about choice and quality. Which leads me to the second area that I'd like to talk about today. Some have said that healthcare reform is too expensive and that we can't afford to do it. I have to say that this is a very legitimate concern. Yes, it is expensive. It also seems to be a concern that our president has and that the Congress has, because I have heard all of them talking about the cost. And I've also heard them say they are committed to producing legislation that will be paid for so that it won't saddle our children and grandchildren with debt. We also have to consider what it will cost if we do nothing, because that is an important part of this discussion about cost. Doing nothing to fix healthcare means that families with Medicare or employer-based health insurance will likely see their premiums nearly double again in the next 7 years. If we do nothing to fix healthcare, the share of your income spent on healthcare will nearly double in the next 7 years. When 1 in 3 Americans say someone in their family skipped pills, postponed or cut back on needed medical care, when countless bankruptcies are related to medical expenses, when the number of uninsured approaches 50 million, when government spending on health care programs rises so rapidly that it jeopardizes all of the other priorities of our country, and when employers struggle to pay for the cost of health care, the fact is that we can't afford not to fix it. Now, there are special interest groups trying to block progress on health care. And they're using distortions, they're using lies, they're using scare tactics. Throughout the debate on how to fix what's broken in our healthcare system, AARP pledges to help you to cut through the noise, to cut through the distortions, and find the facts about what healthcare reform means for you and for your family. When we see special interest using scare tactics, we'll make sure that you're given the facts so that you can make informed decisions about healthcare. Please let us know if you have any questions or concerns about what you're hearing, about what you're reading about healthcare reform. Again, thank you for your interest and for taking time to be informed. Thank you.